Senator Singh.
Thank you, Madam Acting Deputy President. Last Saturday I attended the annual Rainbow Dinner and Awards in Hobart to mark World AIDS Day and to acknowledge the passion and commitment of various individuals in breaking down discrimination in the LGBTI community. World AIDS Day has been held on the 1st of December since 1987 each year and is the longest running health awareness day. And I would like to also acknowledge the contribution of Senator John Faulkner on raising awareness of this important day in his contribution he made previously in this chamber. David Foster OAM is the 2013 World AIDS Day Ambassador for Tasmania, and he sums up exactly what World AIDS Day signifies. Life gets so busy and there is so much to be concerned by, which means that sometimes we forget about the big issues facing others. HIV is one of those issues. We have to refocus on raising awareness of HIV. We need to come together as a community and support those who need us. And so we cannot become complacent in dealing with this disease. HIV/AIDS is still a disease with no cure and remains a global epidemic often forgotten in the Western world. Many of the same barriers which have fuelled the epidemic over the past 30 years are still in existence. These barriers must be broken down to properly tackle the disease. Stigma, discrimination, attitudes and practices that impede the application of treatment options and prevention programs. Individuals facing these barriers are often left in isolation from the mainstream support systems that do exist. Solutions require focusing on key affected populations with partnership between community organisations as well as policymakers. In Hobart, like in many capital cities, World AIDS Day is an important opportunity to fundraise and to raise awareness in our community. Funds such as the Andrew Shaw Fund, which provides emergency relief to Tasmanians living with HIV/AIDS and their carers. The Tasmanian Council on AIDS, Hepatitis and Related Diseases runs the fund and is highly active in education and support in our Tasmanian community. The spirit and passion of individuals in this association and others like them around the country are very much to be commended. Tackling stigma, discrimination and the fear which still exists around HIV/AIDS encourages us to move past the diagnosis and onto long-term, comprehensive policy and prevention. As Australians, we work towards an international dialogue on the prevention of HIV/AIDS. Many countries, including developing countries, have made huge advances with combating the AIDS epidemic. The United Nations organisation, UNAIDS achievements should be commended in this area, with more than 80 countries increasing their domestic investments for AIDS by over 50% between 2006 and 2011. More than 7 million people now on HIV treatment across Africa, with new HIV infections and deaths continuing to fall, and renewed commitments in Eastern Europe, Central Asia, the Middle East and North Africa. The International AIDS Conference will actually be held in Melbourne next year in 2014, the largest medical conference held in Australia that will help us focus our fight. It is a fantastic opportunity for Australia to develop prevention policies, engage with experts in the areas of policy and of science. We have the responsibility to work to prevent further increases in diagnoses. Testing more, treating early and staying safe should be our focus. And I believe we can achieve this through education, better access to options and working together with civil society. Risk reduction strategies launched by community organisations have greatly improved transmission rates. Key to early detection and treatment is access to flexible, easy and quick testing. Rapid testing gives people results in half an hour in a non-threatening environment, and is now available in specific locations such as New South Wales, Queensland and Victoria. Effective treatment can result in the undetectable viral load, which dramatically reduces transmission rates. World AIDS Day reminds us all in Australia that we have the responsibility to continue the fight against this global epidemic, and I encourage my Senate colleagues to help the efforts in ending HIV/AIDS.
Thank you, Senator.